sort of facts that might surprise you. 40% of our time is spent on prevention. Now, if you talk about prevention on prevention from fire, that's what it was years and years ago. If we use an evidence-based approach and overlay the data, the most vulnerable people from fire are also the most vulnerable people from health inequalities. There's an absolute link, and that's not something that we guessing at. That is an evidence-based approach. That's telling us. So we believe in this so deeply. You know, this is integrated into our strategy. It's not something we're thinking of doing. It's not something we're going to do in the future. It's part of our culture, as it is now. All our prevention work. And Kate is still describing, and she's not only a firefighter, but she's what we call one of our vulnerable persons officers, who has a great understanding of health inequality and health and wellbeing, and they're able to apply some interventions to make these people safer, not just from fire, but across the full range of things. Now, also, to underpin this, I guess everybody's aware of the Marmot principles. Well, we are the first fire service, West Midlands Fire Service, the first fire service in the UK to be formally endorsed by Sir Michael Marmot. And our work against these 6 key principles. So it's an absolute integration into what we do and what we can contribute to the wider social and health agenda. So what I want to do, I want to invite Kate up, and she's going to just talk through a couple of case studies about these real life cases, which are far more interesting than me giving you some strategies. So Kate.
Thank you. As Neil mentioned, I'm a firefighter with West Midlands Fire Service. I've been a firefighter for 10 years now, but an additional role, which is voluntary, is a vulnerable persons officer. I've been doing this for about 3 years. I've got a large caseload at the moment, as you can imagine. I have got a few cases that I can talk about. One's very long, so I'll try and shorten it a little bit for you. My training was about a week's course. Julie could speak, but she doesn't want to. It was all about mental health issues. It was about going into the homes, interacting with elderly, vulnerable people, heavy smokers, disabled, vast amounts. So obviously it was crammed into a week, so it was kind of like a learn-on-the-job role. With my watch, I work with obviously other people on watches, so I'm the only vulnerable persons officer on my watch. So when we go out, and it could just be fitting a smoke alarm, a home safety check, which is also what we do. So we go out there, have a chat with whoever's in the property, and see that there's smoke burns on the carpet, ashtrays full, drinking. You can see that there's lots of bottles. You can see that maybe they're confused or they're lonely. We can signpost them to other agencies. We've also got a supply of other things that we can give them, like throws, fire retardant bedding. If they're disabled, they choose to smoke in bed. We can't stop them from doing that, but we can maybe reduce the risk. That's what we're trying to do. So one of my cases was a couple of years ago now. Lovely elderly lady. It actually turned up because we turned out to a job, and it was a flat fire, persons reported. So I turn up there, and you see smoke coming out of the window. You can actually see her in her living room. She hasn't come to the door, she hasn't come out to the property, she's still in a window. So obviously we get in eventually, we bring her out. The ambulance have arrived, and she decides that she doesn't want to go to hospital, she wants to stay in a flat. Now, as you can imagine, smoke-filled property, we have managed to get rid of most of the smoke, but because it was a cooker fire, there's fat up the walls, you can smell the fat. You breathe it in, your eyes are watering. She didn't want to go to hospital. So, cutting a very long story short, we actually managed to persuade her. But as a vulnerable persons officer, I decided to chase it up and make sure that she got referred somewhere else, made sure she was with social services, tried to get a relative as well, because I knew she lived alone. She went to the hospital. I managed to track down her relative, so I rang back to the hospital and I said, I've managed to get the niece in contact. And they said, oh, she's done a runner. She'd left. Now, we had actually found alternative accommodation in a care home for her for a couple of days whilst we sorted out the flat. So I asked my station commander if I could get in the van and drive around and see if I could find her. A frail old lady, I thought she's not going to get far. I actually found her back at her flat, sitting in her armchair, smoke still around, smoking a cigarette. So I get into the door, I have a chat with her and I say I found alternative accommodation. She didn't want to go, she refused. I got the niece there in the end, and she didn't want to stay with the niece either. Now I think if you know elderly people, you know that they you know, especially if they live by themselves, they don't want to be chucked into a care home. You know, they're happy where they are. They don't really want any help. They don't know what help they want. They don't know who can help. So chatting to her, and it did take a couple of days, but I managed to get social services in the door. I managed to get links with other areas as well. I managed to get her a new cooker, because obviously hers wasn't usable. Managed to get the place redecorated as well. And I put her a few links. There was Red Cross, they got involved, and they were able to come out once a week just to make sure that she was, you know, she had some company basically. So that's one case. Other cases that we have had, I don't know if you're aware, but there's a lot of hoarding in our community. So tagging on to that slightly, we do hold hoarding awareness events at Briley Hill Fire Station. We've got another one this year. That's my link with Creative Support. So they come along, and we also get people that are hoarders. They come along and we set up front room fire pods. We put lots of furniture in it, set it on fire, and they see how quickly the fire can spread. So obviously it sets an awareness to them, and then we can work closely with them and see how we can make their property safe and make them safer. That's me done.
Thanks, Dave. So as you can see from Kathy's answer there, that's a really small part of what we do. There was something I didn't mention it earlier. Kate mentioned about our home safety checks that we used to go and visit. Approximately across Black Country South, which incorporates Home and Dudley, we visit 6,000 properties a year, and the majority of those are our most vulnerable. So, you know, my sort of challenge to us as partners is about sharing where these people are. Let's not duplicate the work. Let's make it as effective and streamlined as we can, because all the work that Kate's done, that can be replicated, and we can share how we do things, and we get to reach more people. It's like we've done this over place to do.
Can I thank all of our people? Some of this questions.
For me or Kate?
Right, again. I represent the Dudley Police, and we've recently started this year from our third meeting just gone, Safe Estates. And finally represents the Safe Estate meetings. And the last meeting was only about a week ago. We talked about some issues that we've had with some residents who don't come into contact with us through criminality but through vulnerability, which is obviously what you've identified. Some of the issues we've got, we have got some residents who clearly have got issues with basically officers and people which don't engage in any way, shape or form. One of the ideas was using you guys on what the work that you currently do around mental health and loss prevention to get that foot in the door and obviously get them to understand what it is that we're trying to achieve as well. What I'm looking for really is what your referral mechanisms are around when you've gone to say and address more than once, which wouldn't necessarily feature on our demand profile because we only have so many, which you can appreciate for that particular process. And I just wondered, is there any way that you are already currently linking into local policing through neighbourhood policing around vulnerable areas that we can also tap into as police officers around other support groups that may be able to help you with your work? Have you got anything like that going on at the moment?
I think for me, from working with Chris Johnson for the last 12 months, I think we're looking at working together strategically. I'm not sure if it's filtered that far down yet. Julie might be able to answer a little bit further.
Been to Safe Estates before, we've got filters in there, it's a different problem.
So,
Or just
I think the process is always a byproduct that will happen. This is about triggering your brain or your mind to go, oh, if I can help, or health watch can help, or voluntary services can help, and about that sort of referral.
And I think the same mistakes is a really good thing that we've started up. It's a new concept that we were back for us to kind of catching up where the rest of the policies.
Have you got a referral as well?
It's still an automatic through